Hi, it's Dr. Diegues again. So, going back to the cough workup, something else to consider when you're having a cough and you're planning to go see your doctor is to know whether or not this cough is due to fibrosis. Some people have exposures to occupation fumes, dust, people that work in construction, people that work in farms. Depending on the exposures at work, there could be a type of interstitial lung disease involving your lungs, and that can usually give you a dry cough. That dry cough, again, when you listen to the patient, they will hear some crackling sound, inspiratory crackles in the lungs. And when you see an x-ray and a CAT scan of your chest, they can see interstitial thickening, which basically means scarring of the lungs. So a cough that is dry in nature could definitely be from exposures to something in the past, and sometimes it's idiopathic, meaning that we don't know the etiology, but that could be a fibrosis. So pulmonary fibrosis can be a source of a cough. Have a good day.